Hello friends, I am Dr. Mukulesh Gupta from Udyan Healthcare Private Limited, Lucknow. And as we all know that we are approaching end of 2024, so I thought let me just ponder on whatsoever has happened in the field of diabetes in 2024 and pick the top 3 stories in the field of diabetes. And this is my pick. The first is regarding GLP-1 receptor analogs. Now, we have been talking about GLP-1 RAs for pretty good long time regarding the glycemic control, regarding obesity, regarding ASCVD effects, so on and so forth. But what I am going to talk that in 2024, there was a lot of focus about these agents on non-metabolic complications. So these are heart failure with preserved ejection fraction, where the STREP trial and the SUMMIT trial have given us insight that this particular class of agents are effective in heart failure with preserved ejection fraction. The second part is the obstructive sleep apnea. Now, this SURMOUNT OSA trial has given us insight that GLP-1 RAs can be an effective tool to manage OSA, and it is giving us favorable outcomes in this particular trial. Then coming to the knee osteoarthritis. Here the STEP 9 trial has given us insight of positive effects even in knee osteoarthritis. And in line, there are multiple areas where these GLP-1 receptor analogs are found to be useful, or probably there will be more data. And this is the MASLD, or the metabolic associated steatohepatitis liver disease, PCOS, that is the polycystic ovarian syndrome, Alzheimer's disease, and Parkinson's disease. So these are newer areas where these GLP-1 analogs are found to be having non-metabolic complication positive outcomes. This was an interesting area. And then the second interesting area around the GLP-1 RA is the use of GLP-1 RAs in non-diabetic subjects when we are talking of addressal of MACE. So if we talk of the SELECT trial, which was basically trying to analyze the use of GLP-1 RA in patients, those who are given semaglutide, and patients, those who are not given semaglutide, that is the placebo group. And there, these patients, they are having high cardiovascular disease risk and also having high BMI. And it was found that patients, those who are even not having diabetes, but having high cardiovascular risk and are also having high BMI, here semaglutide was found to be giving us a positive outcome. And therefore, it opens up new area where we can use GLP-1 RAs in non-diabetic subjects with cardiovascular disease and high BMI to have favorable outcomes. So like we have seen with the SGLT2 inhibitors, now they are also being used in patients, those who are having heart failure, even if they are non-diabetics. So probably in coming time, we will see that GLP-1 RAs will also be used in patients, those who are not having diabetes, but is still having high BMI and cardiovascular risk. Then coming to the resurgence of the glitazones. So now this is very heartening that this cheaper molecule now is appearing at higher position in even the current ADA 2025 guidelines as well. This talks of using this molecule in patients, those who are having fatty liver or MASLD. It can be used in combination with GLP-1 RA. It can also be used in patients, those who are having adverse or sitting at a higher risk of ASCVD. And here once again it can be combined with GLP-1 RA to get a better MACE outcomes. At the same time, patients, those who are not achieving glycemic goals with other agents, once again this can come to us as a help, because we know that this is one important group which addresses to insulin resistance, which is so very intrinsic to Indian population as well. And it is cheaper as well, and therefore probably we will see that more and more people or our clinicians will be using glitazones in coming period of time. So there is certainly a resurgence in the usage of glitazones which is seen, and there is a lot of evidence which has come as far as the stroke is concerned, or maybe the MACE outcomes are concerned. Thank you very much for your patient listening.